So let us begin with carving of maxillary central permanent incisor. So before I start any carving, I divide the block vertically into horizontally, and this has been mentioned in my detailed video of maxillary central incisor and on my YouTube channel. So today in this carving I'll be showing you in brief about all the carving steps. So after this division you will get a cross marks on top and plus sign, and divide the block in vertically also roughly into 3 halves. So one will remain for the crown, one will remain for the root, and the lower one will be for base. So this is how we divide. Now let us start with the labial surface. So what I'll do is I will label all the surfaces. So if it is labial, then opposite will be palatal, then mesial and distal. So you all must have seen this carving on my YouTube channel. So today I'll show you all steps very quickly. So on labial surface, divide the block into 3 halves. So before that, you have to reduce all 4 surfaces according to the required mesiodistal dimension. Okay, so do that first and then proceed with the carving. So now this labial surface into 3 halves, and divide this upper 2/3, give an inclined plane till you reach or drop this midline. So this will be your incisor edge. So like this, keep your carver at an angle because we are giving the inclined plane, right? So this is how it will be. So this is how I have given the inclined plane, very clear. Keep little wax, extra layer of wax on the incisor edge, so that incisor edge should be little more thicker. It should not become very thin and knife edge and transverse, otherwise it will become very thin and it will break easily. Now on the lingual surface also divide into 3 halves, right? And now use this convex portion of the carver to create a concavity of fossa. Okay, so this is lower 1/3, upper 2/3. So my convexity will touch here, and then from thumb to index finger move horizontally and create a concavity. So very quickly you can do like this. You can see I am creating a concavity and reducing and towards the labial surface till I get the concavity. So this is how my labial and lingual quickly done. So these are the tricks. Now move towards the proximal. So this is distal, and from here, from this mesial surface, move your carver towards the lingual, because cingulum should be rounded. Now currently it is very flat, so I will give proximal convergence from both the sides till I reach the cingulum towards the midline, so that my cingulum will be rounded. Like this, you can see I have created a cingulum proximal convergence. So from opposite side also I will give the proximal convergence like this. this. You can make out from now I am merging both the proximal surfaces, and you can see I have created a singular converging proximal. Similarly, now my labial surface also should be converging cervically, and it should have nice U shape labial surface as per dimension. So I will give proximal convergence like this from opposite side also, and I will give nice U shape, but currently the dimensions are little bigger, so I will reduce from both the sides little layer of wax. From both the sides according to the dimensions, and I will define the U shape. So this is how my labial surface and proximal surfaces are done. So this is how roughly proximal surface and lingual surface is done. Define the lingual and proximal surface. Now the detailing part of all the four surfaces, we'll do it later. Before that, we will start with the root, polish it little bit to appreciate the labial surface. So you can make out this is our labial surface with all the contours and convexities. Now let us begin with the root. Now before I start the root, I will first reduce all these extra layer of wax and reach till the crown, the surface. Okay, so this extra layer of wax I'll reduce. Now I can use the cutting edge of the carver and move horizontally from my thumb to the index finger. So I will hold vertically my block and I will move horizontally. Quickly you can do it in exam because this is a gross reduction. So you don't need any fine carving. Okay, so just hold because you have enough support on the wax block. So you can easily apply pressure. Then while shaping of the root, you have to be little more careful because you are creating a root tip, which is a delicate part of the carving. So now you can apply as much as pressure you want. And this is how I have reduced all four surfaces. Now all four surfaces, first it should be in the parallel to each other. Okay, because upper 2/3 of the root is parallel. You can see upper 2/3. If you see, the upper 2/3 of the root should be parallel and then gradual tapering. It should not be like exactly ice cream cone. Okay, because we are talking about conical shape root. One more thing, like in exam, like if this stroke is not working, you are not expert in reducing like this, so then what you can do is you can use the straight end of the carver, place it here near the tip and give little angulation and then reduce, so that you are going inward and creating a concavity. So like this, my carver is at angle and go inwards. Now you can make out I have created a concavity. Okay, so the root tip is going in inward direction. Okay, so it will help in creating, see, you can make out like this. Similarly on opposite side. Now the last side. So from all four sides. On all four sides you need to reduce. Now still this step is there, extra layer of wax. You can reduce it easily and give the tapering. The root is uneven, root outline is uneven. Make it proper. So you can make out it is parallel, the outline is parallel, and then there is a gradual tapering. So like this. Now when you see the root cross section, it is not square, okay? So labial surface, it is flat, and then it merges towards the lingual surface. So it is roughly a rounded triangle. So that you need to maintain and give tapering. So roughly our root is also done, and it should be tapered at the root tip. So define the root tip. Now when you submit your carving, your base should be very smooth and shiny with sharp line angles and point angles. Okay, so it looks nice. So if you have done proper crown and root, and if your base is not very clean and smooth and shiny like a proper cube, then it won't look nice, right? So remove the extra wax on the top of the base, make it like a tabletop. And polish it. Now when you polish, the polishing steps are, you have to polish in 3 steps. If you are doing the crown, then hold only crown, then root and base. So do not hold your block like this for polishing, okay? And if you apply pressure here, it will break. So now currently I am using only the crown, and hold your crown between the 2 fingers and move horizontally like this and polish it like this. And now the root part. If you are doing the root part, polish only the root part. If you are doing the base, hold on. Even the top of the base should be very smooth, and it should look like as if you have done the tooth separately and you have fixed it on the tabletop. Okay, so there should be a clear demarcation between the root tip and the base. Okay, now we will define the fossa. Now for fossa, what I do is I use this tip of the carver but near the cutting edge, and I move along the margins, and I'll be 1 mm inside all around, so that my incisal marginal ridges also will become prominent automatically while carving the fossa. So for this I will move like this, and now last side this. Now polish it. You can see nice fossa with the base, with the marginal ridges, and define your labial surface and cervical line. On proximal surface, cervical line is convex and convexity is towards the ground. Here also other side convexity is towards the ground, and on lingual and labial it is on the convexity is facing towards the root. Now polish it. Polish it, remove all the sharp edges like this. So this is our maxillary central incisor. Now very important feature is side identification. Okay, so mesially the mesio-incisal angle is sharp and the other should be rounded. So then what I'll do is I will round off the opposite angle, so that you can clearly make out sharp and rounded. Once you do the rounding, the incisal edge become thick. So then you need to reduce equal reduction, do the equal reduction from both the sides, so that you maintain the centering of the ridge. So little reduction from labial side and little reduction from lingual side. And this is how the incisal edge has become thin. Polish it. Like this. Now some people create mamelons and little ridges. Okay, so it's your choice. You can make it. But in cosmetic treatment, they do it. Okay, as per the opposite intact central incisor. So you have to create a mirror image of restoration or a bridge, right, as per patient requirement. So this is how you can see our central incisor is done. So this is labial surface, this is distal surface, palatal surface, and mesial surface. Okay, and this is the incisal view, sides, and this is how our central incisor is done. Thank you. So let us begin with the carving of maxillary lateral incisors. Now for this carving I have already done the root part to save the time, and if you want to know the detail of root carving and right from first step, you can follow the central incisor carving. Okay, so for maxillary lateral incisor it is little smaller than maxillary central, and I will do the crown and show you the differences between the crown of maxillary central and lateral. So similarly, like how we did for maxillary central incisor, divide the block into three halves, and palatally also cervical line and three halves, right? So on maxillary labial surface, the labial surface of maxillary lateral incisors, don't touch the cervical, and upper 2/3 you reduce, same like central incisor, till you reach on this top central line, which is our incisor edge. So similarly, like central incisor, keep your carver at an angle, right, the straight edge, and reduce till you reach the center on top, like this, so little more, like this, and then lingually also don't touch the cervical, 1/3, and with the convexity of the cutting edge of the cover reduce till you reach the center line. Like this. Now you can see in few minutes our labial and lingual is done. Now this is little smaller than maxillary center, then proximal reduction, reduce proximally and go towards the cingulum, the center, this line of the cingulum. So stop here from proximal and stop here, and convert the lingual, broader lingual surface into narrow lingual surface, that is cingulum. Okay, so we are creating a cingulum. You can see the convergence. Now opposite side, reduction, like this, reduce, like this. So you can see our cingulum convergence from both the sides is done, and we have got the extra step on the root wax, so that I will reduce and merge it with the crown surface. Okay, like this, like this, and on this side also reduce, so that both the crown and root surface merge on the same plane. Now you can see the root is little plump on this side. Reduce the root bulk, like how I said, the root should be parallel for upper to third outline. Like this, it should be parallel, the outline, and then smooth tapering, and it should be roughly triangular in shape in cross section. Like this. So this bulk I will reduce. Now the labial surface should not be flat, right? So it is convex this way also and this way also. So reduce on both sides, both proximal aspects, margins, and incisor-cervically we already have convexity, and this way also. Make it little smaller, the crown. Mesiodistally, as per dimension, it should be little more squarish in shape. Reduce and give the cervical line, carve the cervical line, and create nice U-shaped crown on labial, lingual, and then proximally it should be convex towards the crown. Here also should be convex towards the crown. Reduce this extra wax and merge it with the root surface and crown surface. Now polish it, remove all the rough edges, like this, and make it very smooth from all four surfaces. So this is how from all four surfaces. It will look like. Polish the base also. Polish the base. And sometimes the root tip is distally tilted. Okay, so you can create a distally tilted root. Now the difference between central, maxillary, central and lateral is the crown is smaller in maxillary lateral and both the angles are rounded. So mesial is more rounded and distal one, mesial is rounded and distal one is more rounded. So if this is our mesial, little less rounded like this. If this is our mesial, rounded, distal one is more rounded. So I will create a rounded mesial and distal one I will create more rounded. And the incisal edge slopes distally very prominently. So my distal edge should slope distally. It is not straight like central incisor. Like this. After cutting, you can see the edge has become thick, so I will reduce equally from both the sides to maintain the central axis. So little reduction from this side and little reduction from this side, upper to third. And maintain the convexity on the labial surface. And polish it, remove all the rough edges, and this is how our maxillary lateral is also done. So this is little bit sharper, it slopes distally, and this is more rounded and distal sloping edge. So we can create little sharpness on mesial like this. So this is how our maxillary lateral would look like. And create a fossa with ridges and polish it like this. So this is how our maxillary lateral is done. Now we'll see the difference between central and lateral. So this is how maxillary central and lateral, cingulum and fossa. So see the dimensions. So this is how our maxillary central and lateral is done. Let us begin with mandibular central incisor carving. Roughly I have carved a root to save the time, and if you want to know the root carving steps, you can follow my maxillary central incisor carving. Okay, so only the differences I'll be telling you here. So the mandibular central incisor crown is a little more elongated and narrow, and dimension wise it is smaller. There are few other differences also. So divide the block on top into a plus sign and select the dimension accordingly. To dimension I have reduced already. Now see, this is mesiodistally little wider, so this is my labial surface, and this line will have incisor edge. So I will reduce till I reach on this line, same like incisor steps. So I will divide the labial surface into 3 equal halves, right? and upper 2/3 I'll reduce till I reach this central line. So reduce it, and only the upper 2/3 till you reach the central line, like this. Little more, like this. And now the lingual surface same. So divide the lingual half into 3 and don't touch the cingulum, and upper 2/3 with the convexity of the cover. Reduce till it touches the labial edge, but keep 1 mm of wax at the incisal edge. Okay, now you can see my labial surface has become too sharp at the bend, at the inclination. So make it smooth, it should not be sharp. And this is how our labial surface is done. Define the cingulum. Now carve the cingulum, seam like incisor, central incisor, maxillary. Reduce and go towards the cingulum till it reaches the central, little away from the cingulum axis, the central axis of the lingual surface, and merge both the proximal surfaces. And this is how our cingulum is done. Now labially also make it more U-shaped crown, like this, like this. So this is how our labial surface is done, lingual surface is done. Now after reducing the extra layer of wax, you can see, reduce that wax and merge the crown surface with the root surface. Like this. Your incisal edge should be straight, like this. Incisal edge in mandibular central incisor is straight with both the angles sharp. Cingulum is not so prominent, even the fossa is not so deep, and the crown is more elongated, like this, like this. Fossa is more elongated, cingulum is less prominent, like this. Okay, now polish it, make it smooth, make it smooth, make it smooth, and see the detailing of the carving. And then after you polish, it's time to carve the detailing of the crown. So now you can see my carving is elongated little bit, the crown is elongated, and both the margins should be, both the halves should be mirror image to each other. Okay, so it is bilaterally symmetrical crown. The crown is bilaterally symmetrical. I will define the cervical line so that crown margins can be very well appreciated, like this. You can see this, and define the cervical line on proximal also, convexity is towards the crown on proximal, like this. You can see bilaterally symmetrical roughly. The fossa is shallow, cingulum is also shallow. Okay, cingulum is also little shallow, not deep like prominent like maxillary central incisor. at the crown and root, no, very delicate, and you have to be very much controlled in your carving stroke, otherwise carving will easily break. Okay, so the incisal edge should be straight. So if you have created edges, you can make it straight. Now you can make out my incisal edges nice straight, because the crown is bilaterally symmetrical. So you can make out this is our mandibular central incisor. So again I will keep all the three carvings together: maxillary central, maxillary lateral, and mandibular central incisor carving. Okay, thank you. So let us begin with the mandibular lateral incisor carving. The steps are same as that of incisor, only few differences are there as far as anatomy is concerned. So in this carving I have carved the root already, and if you want to follow the steps of root carving, you can visit my channel and see the steps of root carving and maxillary central incisor carving. Now this is my little wider dimension, so I will keep this as mesiodistal, and I will divide the top into plus sign, and this wider line will be my incisor edge. Now same like other incisors, I will divide the labial surface into 3 halves, and I will reduce the labial surface till I reach this central line, which is my incisor edge. So upper 2/3 I will reduce with the straight one of the line angle of this straight end of the carver till I reach this central line. So this is how I have reduced the upper 2/3 and given inclined plane. And similarly on lingual side also I will use the convex portion of the carver to create a concavity. So here upper 2/3 I will reduce, and I will use the convex portion of the carver, which is a cutting edge, and I'll move between my thumb and index finger. So this is how my infused strokes, my lingual and labial surface is done. Okay. Now the proximal reduction, I will use the one of the line angle of the straight end of the carver, and I will move my carver from here to here, from labial surface towards cingulum, like this, so that if you see from top I have created a convergence. Similarly I will reduce from here, so I will keep it horizontally, and I will move my carver and then join both the contours so that you will get cingulum, converging cingulum. Okay, so after reduction you can see there is a step of wax. So we need to reduce till the crown and root surfaces, they are in the same plane. There shouldn't be any step at the cervical line. So reduce and merge both the crown and root surfaces, and your root also should be converging towards the center of the lingual surface. It should not be squarish, it should be rounded triangle, like this towards the cingulum, and root should be tapering. Then remove all the line angles and polish it. So polishing is very important. Hold only crown if you are doing the crown polishing. Okay, don't touch the junction of root and base. Polish it. Now you can see very thin crown, root, and polish the base. polish the base like this. Now carve the fossa, same like incisor. Same like maxillary central incisor and other incisor. You can see fossa with incisal edges, incisal marginal ridges. Now mandibular lateral incisor crown will define the cervical line first, so that the crown demarcation can be seen very clearly, and then we can decide the site. So crown outline will be clearly evident after cervical line. Now you can see this is my crown from all four surfaces. Now mandibular lateral incisor crown is distally sloping, okay, and disto-incisal angle is rounded. So I will make the disto-incisal angle rounded like this, and crown is more elongated, so make it more elongated crown like this, and cingulum is distally shifted. So this is my disto-incisal angle, so I will reduce more mesially so that my cingulum is more shifted towards the distal aspect, and after reducing, merge the crown and lingual surface. Like this, you can see from top crown the cingulum is shifted more distally. It is not in the center, it is more towards the distal side, and this is how mandibular lateral incisor is, and it is more wider. It is more wider than central. So you can see the differences between central. Central is more bilaterally symmetrical, and distal one is more wider. And see the angle. So this is how you need to carve whenever you are doing any filling or any carving. Thank you. Let us begin with maxillary canine carving. So in this carving also, the root with the distal tilt I have already created to save the time, and I will be showing only the crown. So for the crown, same like incisors, carve the plus sign on top and select the wider dimension as mesiodistal, right? And labial surface in canines does not have flat incisal squarish surface. Instead, it has prominent labial ridge in the center, and on either side there are inclined planes. So first of all, I will carve the inclined plane on this side and next this side. So I will use one of the line angle of the straight edge of the carver, and I will keep my carver like this at an inclination like this, and I will reduce, okay, the 1/2 of the length of the crown like this. I will create a inclined plane. So this is how, if you see from top, this is my ridge, labial ridge, and I have created an inclined plane. Now on opposite side also, with the line angle, create a ridge and create an inclined plane, and this is how, this is our labial ridge and the inclined plane on either side. So you should have prominent labial ridge and inclined planes on the labial surface. So if you see, this is our ridge, and on either side we have inclined plane, and if you see from top, it will be like this. Now we need to converge the proximal surface towards the cingulum. Cingulum will come on this side. Okay, so before that we will divide the lingual surface also into 3 halves, and we will roughly create a fossa. Okay, so we will not reduce too much, because then single fossa we need to convert into 2 triangular fossa. So roughly create a concavity with the convex portion of the carver in upper 2/3. Don't make it too flat, because later on we need to create a lingual ridge, same like maxillary ridge. Okay, so roughly I have kept extra wax here. Keep the incisor edge little thick, because we need to carve the lingual ridge. Okay, so this is how it is done. Now use convex portion of the carver, and on either side, on the center, on the lingual surface, just scoop out depressions vertically from cingulum towards the incisor edge. Keep the central wax intact, which will be our lingual ridge, and on the either side where we have kept extra wax, reduce the wax to create 2 fossa like this. You can see this is one platform, this is one concavity, and this is another, and lingual ridge is also prominent, right? And maintain the central axis of the crown. That means if you join the root axis and the crown axis, it should fall in the center of the crown. Demarcate the inclined planes on either side of the labial ridge like this. See this. Okay. Now carve the triangular fossa on either side, and maintain the intactness of lingual ridge, and same like maxillary central, define the fossa, but it will be triangular in shape. So these triangular fossa should be very prominently seen. Like this. We can define more. Like this. Polish it. Polish the carving. Remove all edges. Now these canines have cusp and cuspal slope at the incisor edge. So currently our incisor edge is little on straighter side. So there are 2 slopes extend from tip of the cusp towards the incisor angle. So mesio-incisor angle is smaller and it is not so slopy. So just little away from the horizontal plane like this. Carve mesio-incisor, and disto-incisor is more longer. So carve little more, define the sharpness of cusp, and this is how longer distal incisor, and distal incisor angle is little more rounded like this. And to give a natural look, the mesioincisal slope has little concavity like this, and the cervical portion of the distal margin also has little concavity. So like this. You can see the crown. Define the details on the crown and polish it properly. Polish it properly. So this is how our crown is done with the two triangular fossa. Define the cervical line. Define the cervical line. Maintain all the contours. Define the cingulum. Cingulum is very prominent in maxillary canine, and after reducing cingulum you get extra bags. And if you make any mistakes in exam, so you should know how to manipulate on how to rectify minor details. You can change like incisor angles, right? So this is how our maxillary canine is done. So I was talking about that distal tilt, by mistake it has gone to mesial. So suppose if such things happen in exam, so you can still change the distal tilt. Okay, so reduce the convexity on the side which you have created and make it concave, and change the root tip to the opposite side like this, because only single block will be given to you like this. Can you see? Now this is my distal surface, and now the root tip is shifted towards the distal. So that is why I keep little extra wax for rectification. Okay, so 1 mm extra wax all around if you keep, you have a good scope of changing the morphological features on your carving. So this is how you can see maxillary canine carving. Maxillary canine carving with the mesial slope, distal tilt, and the root. Root is little bulky, I still feel, on lingual surface. So I can reduce it. So today I am not using soap water polishing, but you have to do soap water polishing after complete dry cotton polishing. Polish the crown, and now you can see this is our carving, with distal tilt and canine crown with all the features, lingual ridge and labial ridge. Thank you. Let us begin with carving of mandibular permanent canine. The steps are all same, only minor differences are there. So here I have already carved root with the distal tilt, and crown roughly I have reduced according to the dimension, and this dimension is my wider dimension. So I'll keep this as mesiodistal dimension, and this will be my labial. So same like incisors and maxillary canine, I will divide into 3 halves vertically, and I will divide lingual also into 3 halves, and I will reduce the upper 2/3. Same like maxillary canine with the same procedure, and reduce the upper third, and I'll be very quick in carving, as you all know the steps of canine carving. So reduce till you reach the central line, then use convex portion of the carver and reduce fossa, keep little extra wax and reduce like this. Fossa is not so prominent in mandibular canine. Then give inclined planes along the central axis with a straight end on either side of the labial ridge. The maxillary canine is little more flatter than the mandibular, than the maxillary canine. And then with the curved end on either side, scoop out vertically the fossa, and then you will get ridge also, and ridge should be concave, right? So it should follow the platform like this. And then cingulum, reduce the proximal surface, move towards the cingulum from both the sides, mesial and distal, and then after you get, join both below the cingulum, and this is how you will get prominent cingulum and convert squarish labial surface into nice U shape. Labial surface, so labial surface will become nice U shape. Lingual also, we can reduce the lingual cingulum because it is not so prominent. This is how the cingulum is reduced. Now after giving, you can see there is a step of wax, so reduce that and merge the crown surface with the root surface so that both are in the same plane. There is no step and ridge at the cervical line. Polish it. And now it's time for polishing, and then we will define the cusp tip and cuspal slope. Now this is our flat, so give a distal slope like this, mesial slope little sloping like this. Polish it, polish the root, and you can see nice lingual ridge, labial ridge. Polish the base. And this is how our mandibular canine. Now I feel the mandibular canine is little wider, so I will reduce proximally, because mandibular canines, they match the mandibular incisor dimension roughly, so they look more thinner and elongated, not like flared maxillary canine. So the crown is little more narrow and elongated like this, with shallow crowns, a shallow incisor canine fossas, two triangular fossa. So this is how our mandibular canine is also done. So if we compare, maxillary canine is more flared and mandibular canine is more long and narrow and thinner with less prominent fossa and sacula. Thank you.
So let us begin with maxillary first premolar carving. You all must have done maxillary first premolar carving and submitted also. So now I will tell you the tricks and tips of maxillary first premolar carving. So I have already made roughly the crown and the root, two roots. So let us concentrate on the occlusal surface. So occlusal surface, briefly I will tell you, like it has a buccal surface which resembles canine, and both the proximal surface, they converge towards the lingual and they form nice U-shape contour. Okay, if you see from the occlusal surface, and crown is elongated buccolingually. Now when you start the crown, you have to divide the vertically the block into vertical halves and horizontal half, and then shape it up, carve two roots, and this much you must be knowing how to do the premolar carving. So I will just show you the inclined planes and the occlusal surface. So now currently my occlusal surface is flat. So what I'll do, with the one of the line angle of the straight edge of the carver, I will use my use as a knife, and on both side of the central line, which is crossing buccolingual border, I will carve two inclined planes, and I will convert the flat surface of the occlusal surface into hut shape, the roof of the hut. Okay, so I am keeping my carver at an angle on one half of the occlusal and giving the converting into inclined planes, and it should not be too much, little slopey from the imaginary horizontal plane. Now you can make out my occlusal surface has become inclined and it is resembling the roof of the hut. Now you divide equally buccolingually, so by a central groove. Okay, so now this is a central groove, and accordingly my occlusal surface has been divided into 4 quadrants. Now each quadrant we will carve to carve the inclined planes of occlusal surface. So this is very important. There is a video how to carve inclined planes of cusp, but now again I will tell you in brief. So select one quadrant at a time, and how to position the carver. Now tip of the cusp of the carver, like suppose I am doing this quadrant, so this is my quadrant, and place your carver parallel to the central groove, right? And your tip should be 1 mm inside of the border. When you start from the buccal surface, it should be 1 mm inside, and when you consider the mesial marginal ridge, it should be 1 mm inside, and place your carver parallel to the central groove and keep it here, and from here like a slide you move towards the center, so that you are creating a slide, and slide will start from buccal and it will slope towards the central groove. Okay, so this will be my position of the carver, and see the angulation, it is more towards the mesial margin, it is an inclined position, right? And pressure should be more towards laterally and centrally. and don't remove this central ridge. Okay, so you can make out I have created a inclined plane and the slope. Similarly, the lingual cusp. Lingual cusp also, you start from the lingual cusp and remove more towards the center. So remove till you reach the central groove, so that there will be nice clear cut line angle or a groove in the center. There should not be extra wax at the junction. There should be clear cut single groove joining the both inclined planes. Okay, and after you cut it, there will be a step near the marginal ridge. So just remove the step and make it slopey. The marginal ridge should be slopey. Now when you do the other side, see the position of the carver. The tip of the cusp is facing towards the center, which is wrong. I had told you the tip of the carver should face towards the periphery. So if I do like this, it will be inconvenient. So what I'll do is I will turn my block, and same procedure I will follow for the opposite side. Okay, so my occlusal surface is already in an inclined position, and I have to just give the cuspal inclined planes like this. And then lastly, remove the step of the marginal ridge and polish it. Remove the extra wax particles and polish it. So this is how your maxillary first premolar with two roots will be done. Then after this, give the define your slopes, and lingual cusp should be little smaller than the buccal cusp. So what we can do is we can reduce the height of the lingual cusp, and the height of convexity should be more towards the center. If you see the cervico-occlusal length, the height of convexity of the lingual cusp is in the center. But on the buccal side, the height of convexity is towards the cervical 1/3 in maxillary first premolar. And then polish it up. And this is how your maxillary first premolar will look like. Now you can see I have given a distal tilt on this side. So this is my mesial side, So on mesial side there are two important features which you have to carve. So this is a mesial pit. From here you have to extend one groove and you have to stop on the mesial side. So this will be mesial marginal groove, and just below that on the proximal surface there is one shallow depression. With the scoop you have to create a shallow depression which is a canine fossa. So what is the logic behind it? The canine is present on the mesial side and it has a bulky proximal contour. So that bulky contour proximal surface, it fits here. So that is why it is called as canine fossa. So on mesial marginal surface, these two important features you need to carve. Okay, so this is how maxillary first premolar will look like. Now little more occlusal convergence of the buccal cusp. Buccal cusp is occlusally. Now you can make out like this, and occlusally also we have nice morphology of maxillary first premolar. Thank you so much. So for maxillary second premolar, I have already made the crown and the root. I will just tell you the differences. So here there is no much height difference between the buccal cusp and the palatal cusp, and the root is single, right, and distally tilted. So only the differences in the occlusal surface I will tell you. Carve the central groove, and same like maxillary first premolar you need to carve, but the length of the central groove is smaller. Okay, so then you have to be more inwards, as the length of the central groove is small and the marginal ridges are wider. Okay, so our occlusal surface is almost done with a small central groove, and remove the steps near the marginal ridges, So remember, you have to be 1 mm inside all around. Okay, so what students they do, they when they carve the grooves, they go through and through, so then you get a cuts at the occlusal surface, which should not be there. So this is how maxillary second premolar will be seen, with short central groove and wider marginal ridges. Both the cusps are almost equal in height, and little contouring on the lingual cusp and buccal cusp for height of contour, like this. So you can see the height of convexity towards the lingual in the center, and this is at the cervical 1/3, single root, distally tilted, and short central groove. Both the cusps are almost of same height. Okay, so this is how these are the differences between maxillary first premolar and second premolar. Thank you so much. So now I am going to show you carving of mandibular first premolar. In this also I have already carved the root with the distal tilt, and roughly I have reduced the crown morphology. So same like other carving, what I will do is I will divide the labial surface into 3 halves vertically, and palatal also into 3 halves, and then same like other premolars, I will carve the plus sign on top, and if this is my labial surface, I'll reduce till I reach this line. Now mandibular first premolars, premolar and molar, they have lingually tilted crown and sloping occlusal surface. Not like premolar in which the occlusal surface is on top. So instead, in mandibular first premolar, the occlusal surface is sloping and the crown is lingually tilted. So labial surface will have nice ridge, buccal ridge with inclined plane like this. And now reduce till you reach the center on the top. Define the buccal ridge after reduction. Now you can see the occlusal surface. Occlusal surface is looking straight. So what I will do is I will reduce the occlusal surface at 45-degree angle, sloping. So I will keep my carver at an angle like this, and I will move between thumb and index finger, and I will reduce till I reach the labial edge like this. So you can make out not much, but only little sloping 45-degree angle. So this would be my occlusal surface. Now I will reduce little more on cervical, so that crown will be tilted more. It will appear more tilted on the lingual side. So you can make out this is my crown and this is my root.
So remove the extra step of wax which I had got after reduction. So like this, so you can make out this tilted crown. Now same like other premolars, carve. Now this is our occlusal surface, but the central groove is not in the center, it is more towards the lingual surface, right? And now after giving cross marks, carve inclined plane same like maxillary premolar. So first, before that, you carve the heart, convert the flat surface occlusal surface into heart shape. Heart shape surface. You can see this is a ridge and two inclined plane. Then divide the occlusal surface into two halves. You can see the buccal distribution is more than the than the lingual. And then same like premolar, 1 mm inside, carve the inclined planes of the buccal cusp and stop exactly in the center. Similarly on lingual cusp aspect also, though lingual cusp is rudimentary, but it has very prominent inclined plane, cuspal ridge and ridge, transverse ridge. So like this, and define the grooves, inclined planes, like this. So you can make out nice cuspal ridge. Remove the step at the marginal ridges which we have got after this thing. You can make out. There should be nice single cuspal ridge. Define it properly. Like this. Polish it. While polishing, be careful. So this is our occlusal surface. I will show you again. Polish it like this. So this is our labial, buccal. Now since we are talking about posterior, so we should say buccal. Now give the cuspal slopes. So this is our tip of the cusp, buccal cusp. Give little cut like this, and on the other side also like this. So see, our buccal cusp is done with cusp tip and cuspal slope. Polish it like this. Even the lingual cusp has cusp tip and cuspal slope, and we can see very prominently buccal cusp, central groove. So we will define more to get the clarity like this. Now see the tilt. This is our distal tip, so this is mesial surface. So one very important groove runs from mesial pit, comes on the lingual surface and ends on the lingual cusp like this. This is called as mesiolingual groove. After you extend this groove from mesial surface to the lingual cusp, polish it. So this is how our mandibular first premolar will look like. So now I will show you carving of mandibular second premolar. So here I have already carved the distal tilt of the root, and the crown shape also I have defined with lingual tilt of the crown, and occlusal surface also inclined plane has already been carved. Now in mandibular second premolar, whenever you do this carving in exam or in regular practicals, you need to carve three carvings based on their occlusal pattern. So there are H, U and Y pattern, occlusal groove pattern. So let us begin. So buccal surface and occlusal surface. The central groove is not more towards the lingual cusp, okay? It is more or less towards the center in mandibular second premolar, like this. And there are H, U and Y. So U, first we will carve U. So U means the buccal extension supplementary grooves are prominent and central groove. So if you join three, it becomes U, and the lingual extensions are not so prominent. So how to carve this U shape? So first we have to carve buccal extension like this, grooves, buccal extension grooves. So buccal cusp, carve buccal cusp, which is very easy, like this. So buccal cusp I have carved, and now do not make this lingual extension. So just move your carver along this step and keep your cutting edge on the lingual side, okay? So this is how, if you just remove the step. So in a process of removing steps, central groove, marginal groove, your occlusal surface will get converted into U shape. Now if we polish, automatically your clear cut U shape pattern will be seen. So we will define little more like this, and central groove. So this is our U shape, and define so this is our U shape pattern for second. Now if we extend grooves on the marginal groove on the lingual aspect also, on the lingual aspect also, then it becomes H shape. So you can make out this is like this. Both the extensions are prominent on both the cusp, arising from mesial bit and distal bit. So if we polish it, this is H shape. This is nice H shape. You can make out. Now last shape is Y shape. Y shape means this is the upper arm of Y, and lingually there are two cusps, and each so we will divide this bulk into two halves, and each half will have nice heart shape carving, okay? And there is both are divided by a groove. So if we consider this U and vertical extension dividing these two cusps will become Y shape. So first I will divide the lingually and then carve the inclined plane for this cusp and for this cusp also, and this is how two lingual cusps will be clearly seen. This is how our three cusp pattern in Y shape will be seen. So, and define the groove pattern. polish it, polish it. Polish it. You can see there are 3 patterns and little bit extension, and each these tiny cusp will have cusp tip and cuspal slope. Okay, so define the cusp tips and cuspal slope. Like this. Now you can make out buccal cusp and 2 lingual cusp, and each half will have cusp tips and cuspals. Define the buccal ridge and buccal cusp. So you can make out the buccal cusp is also very prominent with detailed ridge and groove pattern. Polish it. So this is my 3 cusp pattern Y shape. There is no mesiolingual groove in this carving, which was present in first premolar. Now let us see the occlusal, the crown, how to carve a crown of maxillary first molar. So what I do is, I always divide the block on the top, and the occlusal outline of maxillary first permanent molar is not square, it is kite shape. So what I'll do, the opposite diagonal angles, I'll reduce 1 mm of wax at the corners, so that these 2 angles will become obtuse. So on the crown length, total crown length, opposite both the angles, I will reduce like this, and like this. So you can make out it has become kite shape. Now oblique ridge will run from obtuse to obtuse. Okay, so first I will carve the 2 buccal cusp. 2 buccal cusps. So this dimension is little longer, I feel. So I will keep this as buccolingual. So here 2 buccal cusps, nice 2 buccal. Utilize entire quadrant and keep little wax at the margin for the marginal ridges, and carve 2 nice buccal cusps, 1 in each quadrant. So same like premolar, carve buccal cusp. So you can make out 1 is done, and both the cusps should meet on a single vertical groove. There should not be extra waxing at the junction. So nice 2 cusps I've carved. Now this part is little tricky, but I will explain you in a simplified manner. Now first we have to carve mesiopalatal cusp, which is the largest cusp, and it will be placed here on the obtuse angle. So it will run, the oblique ridge will run from obtuse to obtuse. So what I will do is, I will extend the outer inclined plane of both the buccal cusp till here, and then this cusp will be done. So first, very simple transversation. This will go straight. So on mesial side, it will go straight. So just extend and merge the outer inclined plane of mesiobuccal cusp, and then outer inclined plane of distobuccal cusp. When you are extending, you extend and you go through this quadrant, distolingual cusp, and stop in the demarcation line. Don't enter, so that you will have bigger cusp area for the mesiopalatal cusp. So turn the block and opposite side you just extend the inclined plane and stop at the demarcation like this. So this much area you have got for mesiopalatal cusp. Define the ridge, cuspal ridge like this. And then your this cusp is done. And distolingual cusp is always facing towards the central bit. It is not in the center, it is always facing towards the central bit. Okay, so and it is the smallest cusp. So part of the quadrant we have already utilized for the mesiopalatal cusp, the adjacent cusp. So that is why the surface area available for distolingual cusp is bit smaller. So this is how occlusal pattern roughly it is seen. So after polishing it will be more defined like this. So define the cuspal ridges more. Like this. Now once we do the buccal cusp ridge and cuspal slope, it will be more prominent. So for all four cusps, carve the buccal ridges only for the upper occlusal 2/3. Don't extend these ridges till cervical line because we need to keep wax for cervical prominence. So define so like this. On opposite side also buccal surface. Give cuspal ridges. Buccal ridges. Now carve the inclined planes, cusp tips and cuspal slope like this. Every cusp should have cuspal ridge like this. Like this. Now make the rhomboid more proper. This is our obtuse angle. So make your crown should appear twisted. So marginal ridges should be, the crown should be more twisted like this. So these are my obtuse angles. Give more kite shape on the, so like this you can make out the crown is more twisted. So if you see from top, the crown, the block is squarish and our crown is twisted on the square shaped block. And second molar, they are more rhomboid shaped, they are more twisted like this. So this is kite shape, you can make out kite shape. You can define more define more the rhomboid shape towards the obtuse angles, and like this, define the. So sometimes the wax is soft, so little pressure also of polishing removes the detailing, so you need to maintain the detailing of the ground till you submit your carving. So define the ridges. The detailed carving including crown and root and minor details you can see on my YouTube channel of maxillary first permanent molar carving. So remove the extra wax. Like this. So this is our maxillary first permanent molar carving. And cusp of Carabelli. What you can do is just remove 1 mm of wax from cusp tip till 2 mm, and then you will see a step. So this is our cusp of Carabelli. So this is how we do permanent maxillary first molar carving. Let us see the crown of mandibular first permanent molar. Mandibular first permanent molar, they are elongated buccolingually. Okay, so I will reduce slightly the buccal surface like this, roughly, to make it more elongated, and the occlusal surface is inclined, so the lingual cusps are higher than the buccal cusp. So I will give the inclination of the occlusal surface with the lingual side. This will be my lingual side, will be higher than buccal. So buccal inclined plane I will carve. The crown will be lingually tilted like this, and now I will start the carving. So divide the occlusal surface into plus sign. So there are 5 cusps total on the occlusal. So one cusp occupies the first mesiobuccal cusp, occupies completely this quadrant, and second quadrant divide into 2 halves diagonally, and second cusp will fit in this quadrant, third cusp will fit in this quadrant, and marginal ridge will fit here. Mesiolingual will fit here and distolingual will fit here. So utilize first quadrant for mesiobuccal cusp, utilize entire quadrant. So buccal surface does not have equal distribution of 3 cusps. Okay, so remember, 2 cusps are present, occupy one single quadrant if you divide the quadrant to diagonally into 2. Now the second cusp, place it like this only. It is directed towards the central pit. So the direction will be like this only, facing towards the central pit, like this. And third cusp is distal cusp. Even though it is small, but this is also very prominent, like this. Now this cusp is pointing in between these two, and this cusp, distolingual cusp, will be pointing between these 2 cusps. So there is no transverse ridge. in this molar. So you can make out my mesiolingual cusp is pointing in between two mesiobuccal and distobuccal cusp, like this. And this cusp also, the distolingual cusp also, will be pointing in between distal cusp and distobuccal cusp. So you can make out very prominently there is an interdigitation of the cusp. There is an interdigitation of the cusp. Okay. Now carve the ridges nicely on buccal cusp. On buccal side, 3 cuspal ridges, because 3 cusp, and the last cusp is present. The last cusp is present at the corner. At the corner, and the buccal contour is curved, so it is not straight, it is curved distally. So we need to reduce little bulk at the corner. So distobuccal angle is rounded like this. Okay, and the crown converges lingually. So we will reduce the line angle. So our crown is converging lingually. So dimensions on the lingual cusp is smaller than the buccal width. So it is like this. Distally the marginal ridge is smaller than the mesial. Now we will polish it. We will polish it to see the details. So this is our occlusal surface. Define the cusp tips and cuspal slope like this. So all the 3 cusps should have nice cusp tips and cuspal slope, and the height difference, this is tallest, and then the height goes on decreasing. Similarly on lingual surface also, define cuspal ridges and cuspal slope like this. Extend the groove on the lingual surface, dividing groove between the cusp. Carve the lingual ridges on the cuspal lingual surface of the both the cusp. So each cusp will have lingual ridge, dividing groove, cusp tip, cuspal slope. Even on buccal you have all those prominent features. Polish it nicely. You can see the occlusal pattern. You can define more. You can define more all the cusps. 3 cusp on buccal and 2 cusp on lingual, and central groove is present in zigzag manner because of the interdigitation arrangement of the all 5 cusps. Even the marginal ridges are prominent. Don't forget to carve the marginal ridges and give little pressure to smoothing to remove it. So this is how our occlusal surface of mandibular permanent first premolar is done. We can give the cervical carving, give cervical constriction like this on both the sides. On both the sides, you can see I have given the cervical constriction. Now, to make the lingual tilt more prominent, I will reduce more on the lingual side, more on the lingual side like this, and little more on the buccal side, so that our crown is lingually tilted, and give occlusal convergence to the cusp tips, so that lingual outline is rounded, and buccally our crown is more prominent in the cervical 1/3. So polish it, like this. So this is our mandibular first prominent molar. To make the cervical ridge prominent, give nice cervical outline. So this is our buccal surface, lingual surface, lingual cusps, and this is how our occlusal surface is done and the crown is done.
Let us see the mandibular second molar carving. So only the differences I will tell you. So roughly the grossly root I have already done, 2 roots, and one mesial and one distal. So this is my mesiodistal surface, and the mandibular second molar carving is very easy. You have clear cut 4 cusp, and both the buccal cusp meet the lingual cusp and form a transverse ridge. There is no crisscross pattern arrangement of the cusp. So nicely, this is my lingual surface, it is higher, and crown is lingually tilted. So buccal cusps are here. So in this quadrant I will carve mesiobuccal cusp. Like this. And in the other quadrant, distolingual cusp. Now on lingual aspect, distolingual cusp, and it meets the mesiobuccal cusp to form the transverse ridge. Like this, very simple. And distolingual cusp meet the mesiobuccal cusp. So this is how plus arrangement of the groove very clearly seen, and 2 ridges. So it is very easy to carve mandibular second molar carving. So I will not go in much detail. Let's polish and see. So this is how it is done. Little bit polishing. So this is our mandibular second molar carving, 2 buccal cusp and 2 lingual cusp. Thank you.